Welcome back to Why We Nurse. I'm your host, Serena Tovar. Today's special is all about some of healthcare's most resilient, courageous, and inspiring patients, children. Pediatric nursing is a specialty unlike any other. It requires clinical expertise, creativity, patience, flexibility, and a tremendous amount of heart. But caring for children isn't just about caring for young patients. It's also about supporting frightened parents, building trust with families, and helping people navigate some of the most emotional moments of their lives. Joining me today is Lori Newton, a pediatric nurse whose passion for caring for children shines through every patient interaction. Welcome to Why We Nurse.
Hi, thank you so much for having me.
So Lori, let's start at the beginning. Tell us about your nursing journey and what inspired you to become a nurse.
Sure. So I actually started out as I took like a course in high school to become a CNA. So I did that because I kind of always thought I wanted to be a nurse, but my parents were like, take a course, see if that's really what you're interested in. So I did that, loved it, and then went to college, got a bachelor's in nursing. Getting into pediatrics wasn't ever really what I saw for myself. I always knew I wanted to do like ICU, more critical care. And right out of nursing school, I actually ended up doing like a renal telemetry unit because that was the first job I got. And I was like, I need a job. I got to get a job. So I started out there and then I was like, this is not for me. Like, I don't like the adults. I don't like the med surg vibe. And there was an opening at my hospital for a PICU nurse. And so I applied and I got that position and I didn't really know what I was getting into. My nursing school pediatric rotation, it was in the spring. It was a small pediatric unit and there were 0 patients. So we all got sent to the ER for the day. So I didn't ever really get to experience pediatrics in nursing school either. So it was kind of like my first step into pediatrics and I just fell in love. And so that's where I spent my whole bedside career was in pediatric ICU.
So what do you love most about working with the children?
I love how, like in your intro you did, they're so resilient. And when I think about kids and some of the bad things I would see, like we'd get terrible, maybe non-accidental traumas, things like that, or even just their disease processes. None of these kids asked for this. None of these kids went out drinking a bunch of alcohol, gave themselves cirrhosis and stuff. And I'm not trying to say like adults deserve diseases too, but all these kids are so innocent. They didn't do anything to cause the problems that they had. A lot of them are products of their own environment and their own raising. There's something so great about taking care of kids and the resilience they have and how well they can overcome those things.
And so you said you didn't get a lot of pediatric experience in nursing school. So what makes the pediatric nursing different from the adults you took care of in nursing school?
Oh my gosh. Just learning how to talk to kids and how to explain what you're going to do. Explaining something to a toddler versus a teenager, 2 very different things. And then explaining it to their mom or their grandma that's in the room, another very different thing. So a lot of times you're going into the room to start an IV and you're going to sit down and you're going to tell the toddler, hey, we're going to clean your arm really good with some soap. And then we're going to put a little straw in it and we're going to give the straw a drink. Do the special bag I have. But then you're going to explain it to the mom a different way. And then maybe the grandma another way. So it's like everything in pediatrics takes a little longer too. You can't just walk in the room, throw an IV in and leave. There's a lot of explanation. There's a lot of talk. Sometimes there's a little play to get all warmed up to you. So that was a big like learning curve too when I switched to pediatrics was just, you have to be very patient. You have to explain stuff. Sometimes you have to explain it and then you got to leave the room and give everyone a moment to think about it or to kind of adjust to what's about to happen, and then you got to come back in.
And so you said something that kind of caught my attention. You said you explain something a little different to a toddler than you do a teenager. So in pediatrics, is it everybody all mixed together, like from infants all the way to 17-year-olds, or is it like kind of cohorted by age?
No, all the units I've ever worked in, it was all just mixed in together. You'd have maybe a brand new baby that got discharged a few days ago that's back in for like hyperbilly, needing some lights. And then you could have a teenager that was in a car accident right next door to them. And another thing that I think people don't think about, we also see adults in pediatrics too, depending on their diagnosis. So sometimes like you think of pediatric oncology, like ALL kids, certain types of leukemia are primarily treated by pediatric oncologists. So if they had leukemia as a child, and then maybe they relapse, but they're 19 or they're 20, a lot of times they end up back in pediatric floors because those nurses are the ones that know the treatment protocols and how to care for them. The same with like congenital heart patients. They end up getting treated in pediatric hospitals because those are the surgeons and the nurses and everyone who understands congenital heart defects.
Wow, that's so interesting because I take care of adults. So I'm thinking I take care of from 20s to end of life. And it's not that much of a difference in what I'm looking at. As far as like, this is your normal range for vital signs. It might be a little bit different in a 20-year-old versus an 80-year-old. But when you're thinking about what's a normal range for a vital sign on an infant versus what's a normal range for a vital sign on a 17, 18-year-old, that's very different.
Very different. There's a lot to learn with pediatrics. It's not just, like you said, one set of vital signs. There's a lot of different patho that goes along with it too. If you think about just kids growing up, different types of injuries they can get as your bones mature and things like that. Yeah, there's a lot to know.
What surprised you the most when you first entered this specialty?
What probably surprised me the most is, since I didn't really get exposed to it a lot in nursing school, was just how dang sick kids could get. You don't really think about how sick that they can be because you see a lot of TV shows out there and it's like kids riding bikes through the hospital, and sure that happens, but in the pediatric ICU, like these kids are sick. They have some really bad diseases, and when kids crash, man, they crash quick. But when they bounce back really quick too. So I guess just with adults, you kind of see a trend going down and you're like, oh, this doesn't look so great. Kids, like there were times I'd start out and minutes into my assessment, I'm like, oh my gosh, what's happening? What's happening in this room? Like stuff starts going down and it happens really quick. So I guess that would probably be the most surprising thing, is just how quickly kids can get sick and crash and how quickly they get better too, because they bounce back really quick. Like you could extubate a kid from having RSV and they're super sick on the vent for a while and they're discharged within a day or two because kids just bounce back quick. They're going to get up, they're going to start walking, they're going to run around, they want to start playing. Adults, you're like, come on, you got to get out of bed. You got to go on a walk. You got to keep moving. Kids are ready. They want to go.
Yes. So what qualities do you think the best pediatric nurses possess?
I mean, I think with a lot of nurses, like patience is a big thing, but especially with kids. And it can be hard. You're going to have to explain it, like I said earlier, explain things a lot of times. And a lot of times you got to go in and maybe you're kind of delivering some not so great news, like, hey, we're going to have to start an IV. We're going to have to do this. Your kid's pretty sick. And then you kind of have to let the room decompress. And so you'll have to walk away and you have to come back in. And you're dealing with a lot of emotions in those rooms too, because you're encountering these kids and these parents on the worst day of their life, most likely, and recognizing that and knowing like, yeah, this is just another day in my life. Like I do this every day, day in and day out, but this is the worst day of their life, and giving them time to breathe and adjust to what's happening, I think is really key.
What do you wish people understood about pediatric nursing that they may not realize?
It's not all just fun and games. I feel like sometimes people think we're just playing with kids all day. Like we're just babysitting. Maybe we're feeding some babies. Maybe we're putting somebody on some oxygen, but it's not always fun and games. Sure, we're playing with kids and we're helping them adjust to what's going on around them, but we're nurses. We're watching vital signs. We're watching trends. We're doing labs. We're doing all that stuff too. So it's really a lot of multitasking too.
And I think sometimes people don't understand that you guys have to deal with death and dying as well, that not all the kids get to leave the hospital.
Yeah, that's a really hard thing to deal with too. I wish I could say I didn't see a lot of it, but we do. We see a lot of it. Sometimes I would talk to my family or my mom would bring up something she saw in the news and she'd be like, oh my God, did you see this kid from our hometown died in an ATV accident? And it was so terrible. And I was like, Mom, that happens multiple times a summer sometimes. I see those kids a lot. And they just don't always make the news. You might see one headline of a kid that died tragically in a car accident, or there was drowning in the swimming pool. But that's one headline. That's happening a lot more frequently, I think, than people sometimes realize. And it's very hard. There's a lot of emotions with that.
Yeah. And earlier we mentioned about having to build trust, because these kids are not going to let you start an IV, draw blood, stick things on their bodies, some of these very invasive type things, unless they trust you. So how do you build that trust with the child?
I think I'd always ask parents, like, what do they like something? What's their favorite TV show? Or, I would start just spitballing stuff. Oh, do you like Peppa Pig? Or are you more of a Paw Patrol guy? And you kind of like figure out what they like, and then you start talking to them about it, and you'll kind of see their eyes light up when you hit it on the mark, when you figured out, oh, they're a Hot Wheels guy and they really like Hot Wheels. And then maybe you pull up some Hot Wheels on your phone and you're showing them pictures and stuff. And that's kind of, you gotta win them over. So getting to know your patient and what they enjoy and what they like can really like give you a hand up in the room sometimes.
Okay. What role does play and creativity have when you're trying to earn that trust with the pediatric patient?
I think it holds a lot of value, because that's how kids interact with their whole world. They play, they're imaginative. So I think if you can get a kid to play with you or show that you're interested in something they like, man, that's gold.
Okay. So children are brutally honest. Is there a story that you can share that made you laugh?
Oh my gosh. I'll never forget. We were admitting a patient and I was the charge nurse, and it was a kiddo that we had seen multiple times. They had chronic issues and she was a teenager. And I remember I came into the room and I was just trying to help out. And I was like, hey, can I go get you, like, do you want some water or anything? And she was like, yeah, that'd be ice. And I was like, what? And I was like, you want ice in your water? And she was like, no. I was like, so you just want water? That'd be ice. And I was like, and I just kept looking around the room. I was like, am I being punked? Like, what is happening right now? I was like, do you want ice water? And she's like, nah, that'd be ice though. And I was like, I clearly am not understanding this conversation. And I finally just went and got her water. And then somebody later was like, Lori, that's like the cool way of saying like, oh, that's cool. Thanks. Like, that'd be ice. I was like, neither had I. And I was like, I am not that old. Like, I'm not that far removed. And I just felt like the dumbest person in the room because everyone else knew what she was talking about but me.
One thing that makes pediatrics unique is that you're often caring for the entire family, not just the patient. What does family-centered care mean to you?
So family-centered care is not only necessarily taking care of the patient, but taking care of the family too. And when I think about that, I would think about some of our moms or our dads that would stay and pick you for days on end, nights on end, never even go outside because they just didn't want to leave the bedside. They were scared something would happen while they were gone, and just really encouraging them to do self-care too, because it's hard being stuck in a little room that's nothing but windows so we can see in. They feel like they're living in a fishbowl. They're not getting any sleep because there's a night shift nurse in there every hour doing something. So really helping parents take a step back and tell them like, hey, it's okay to go downstairs, go to the cafeteria, grab a bite to eat, take 20 minutes. I promise I'm going to call you if something happens. So you got to win the trust of the parents too, because they won't do it if they don't trust you with their kid. If they don't think you're that great of a nurse, or maybe you're not that friendly to them, you don't have a smile on your face, they're going to be like, I'm not going to leave my kid with this person. I feel like I have to be here. So really being open and honest with parents, I think, is key, and helping them to realize that they can take care of themselves too. That's okay.
And not all parents exhibit their anxiety the same. So sometimes they may exhibit it in a way that's more vocal or a little louder. Maybe they're frustrated with the progress that their child is making. How do you handle those situations?
So there's a fine line to walk there of realizing again that this is the worst day or moments of a parent's life, but also knowing that you can't talk to us badly. You can't threaten staff. You can't yell at us. Those are unacceptable things. So yes, this is the worst day of your life, but you also can't treat us badly. So there were times that if tensions are getting really raised and it's coming towards the staff, like, okay, we're going to leave the room for a minute, as long as it's safe to leave the patient in there. We're going to leave the room, let it calm down, and then come back in and have another discussion. And never taking it personal. You can't ever take it personal, because I would say 9 times out of 10, I would have parents up screaming in my face about something or mad about it. The next day they would come up and be like, I am so sorry I did that to you, and be so apologetic and just mortified of their behavior. And just knowing that it was a stress response from them. You can't take it personal. 9 times out of 10, it's not personal. It's just their stress response, and they can't handle that emotion. They've never had to deal with it before. I think that's the big thing, is just not taking things personal too.
So how do you, Lori, as a nurse, take care of yourself when you have a difficult day? Maybe you had the parents who were having the worst moment of their life and they weren't the nicest through it, or maybe you lost a child that you had bonded with. So how do you care for yourself?
I've always had really amazing coworkers. And I think a lot of time talking stuff out with your coworkers is great. So if you can find some really good coworkers that also know exactly what you've been through and what it's like, that is super helpful. Also going on walks. So I'll get off a long night shift, and a lot of times that's when I go and walk my dog. It's kind of a way to decompress after your shift, go outside, get some fresh air, take a nice walk. It's early in the morning, so not a lot of other people are out. And it's a great way to decompress before you go to bed. Because I always found if I went to bed with all those crazy thoughts swirling in my head, I'm not going to sleep well, and I'm going to be tired for my next.
How would you say this specialty has changed you personally?
It has really given me a appreciation for kids and what they can go through and bounce back from. Never really thought about it before I went into pediatric ICU, how much kids can go through in a lifetime, but you see it and it's pretty amazing. And then sometimes I'll meet someone and they'll tell me I had childhood cancer, or I had a heart defect when they were little and they had to go through all these surgeries. And I'm like, wow, you went through a lot as a kid. And that's pretty amazing that kids can go through that much and turn out fine, because you see some adults who go through stuff like that and they can't function anymore. They can't handle their chronic illness. They don't know what to do. And kids, they just really are very resilient.
A lot of nurses who became nurses because they had some type of illness or chronic situation when they were children, and they were so inspired by the nurses that took care of them that they grew up and became nurses themselves. And I think that speaks to just what you were talking about, how resilient they are and how they want to pay
really
that
cool
forward.
To see. Yeah, I worked with a nurse one time who had CF. So yeah, that's a chronic illness. Like, you're going to have that the rest of your life. And then to go into nursing and to help other people, I think that's like a very admirable thing to do, like to give back.
What has caring for children taught you about the strength and resilience? So you've talked about the children being resilient, but what has that taught you?
Oh, I think about it
personally?
sometimes when like I get sick and I'm like, oh my God, death is upon me. I have a temp of 99.2 and I think I'm just about to keel over sometimes. And I'm like, you know what? You took care of a patient last night that had a temp of 104 and you were playing Barbies with them. You need to suck it up and get out of bed and you're going to be fine. So I think looking at it and like, oh, if a kid can do this, I can do this. Like, if a kid can be sick and get up and walk around and participate in stuff, I can too.
I agree. I feel like that sometimes. I'm with you. Once I get to 99.5 or whatever, I'm already having chills.
Yeah.
I'm done for. Just give me my blanket.
Right. Yeah.
Just call me in the morning or something.
Yeah.
I don't want to
And then I see
participate
kids
in
and I'm
life
like,
anymore.
how are you awake right now? How are you not just curled up in the fetal position, just wanting to cry yourself to sleep?
What would you say is the most rewarding part of being a pediatric nurse?
I think seeing when you take care of a kid who is so sick and sometimes you don't know if they're going to make it or not. And you're like, we're doing everything we can. And then you finally see them get better and you're able to pull the breathing tube and then you hear them laugh for the first time or you see their smile without the breathing tube around it. Oh my God, it's so cool. And then you pull that breathing tube and then you're able to hand the baby off to mom. And now mom's getting to cuddle them and she hasn't been able to do that in a week. It's really sweet. It's a sweet moment and it makes it all worth it.
If there is a nursing student or a new nurse who is listening right now and is interested in pediatrics, what advice would you give them?
You didn't get a good pediatric rotation in your nursing school like I did. Apply for a pediatric job and just see if you like it. The great thing about nursing is you don't have to stick to anything. And if you think you're going to like pediatrics and you're a patient person and you really love caring for a whole family, because that's what you're going to end up doing. You're not just caring for a patient, you're going to care for a whole family. Then peds is probably the place for you. Even if you didn't get that experience in nursing school or you haven't had a lot of experience, maybe you'd never even held a baby before. Doesn't matter. I hadn't held a baby before. I went to peds and it was great. It's a great place to be and to have a career in. There's a lot of reward to it.
Lori, thank you so much for sharing your story and your perspective today. Your work reminds us that pediatric nursing is about so much more than treating illness. It's about creating comfort in fear, finding joy in difficult moments, and supporting families through uncertainty, and also helping children heal with dignity, compassion, and hope. Every day, pediatric nurses make a lasting difference in the lives of children and families, and that's why we nurse. Thank you for listening to Why We Nurse. Follow us on Instagram and Facebook at Why We Nurse for updates and behind-the-scenes content. Have a story to share or want to be a guest? Email us at whywenursepodcast@gmail.com. Until next time, stay compassionate, stay curious, and remember why you nurse.